So my name's Deborah Neesham. I'm a gynae-oncologist who works out of Francis Perry House in the Royal Women's Hospital in Parkville. And I'm going to talk a little bit today about ovarian cancer and what the role of looking for symptoms and what to look for and when to go and see someone about your symptoms. The problem with ovarian cancer, and it's well known as being the silent killer, is that often the symptoms are very non-specific. It's often difficult to diagnose, and a lot of women will have the non-specific symptoms of ovarian cancer and wonder whether there's any concern for themselves. And we know that most of these cancers will arise in women after menopause, and a lot of the symptoms that we talk about are more common after menopause. A smaller percentage of women will develop ovarian cancer before menopause, but again, not very commonly. The overall incidence or risk of developing an ovarian cancer for any woman is about 1 in 80 across her lifetime. So it's not a particularly common cancer, but it is hard to pick up. So the things that we do look for are obviously any changes in periods in terms of abnormal bleeding between periods, any significant bloating with the abdomen swelling up, and they have difficulty eating large meals. And this is usually because there's a production of fluid in the abdomen that takes up a lot of room. Now, this is indicative of an advanced cancer, and therefore it's not really an early warning sign, it's a sign that there's something already happening. The symptoms of changes in bowel habit, changes in urinary frequency, all of those sorts of symptoms are very common after menopause, and a lot of the time they have no significance with respect to the ovaries. But if there's a new symptom that is persistent, then one option in terms of checking the ovaries would be to have an ultrasound performed. But we don't routinely do ultrasounds to check the ovaries because they are active up until menopause on a monthly basis with egg production. And after menopause, you can still develop cysts on the ovaries, which are still very benign, but it's a matter of checking those ovaries if there's a new problem that you are concerned has given you new symptoms or things that you're worried about. In terms of screening for ovarian cancer, unfortunately, there are no good tests available. And while an ultrasound will tell you that the ovaries look normal, it won't exclude a microscopic abnormality. And even women who are at very high risk of developing ovarian cancer due to an inherited genetic problem will still not be recommended to have routine screening because there is absolutely no benefit in these tests as they stand at the moment, because they can only pick up something that is already there and almost certainly has already spread. The new theory about ovarian cancer is that it probably starts in the fallopian tubes, which means that by the time you see abnormalities in the ovary, it means that there's already been some spread from the fallopian tubes. And at the same time as it's picked up by the ovaries, it usually means those cells have wandered off and implanted somewhere else in the abdominal cavity and are already starting to cause trouble. So there's no early detection test for ovarian cancer, and the only thing we can do if someone is at significantly increased risk is to actually remove the tubes and ovaries. And we're not keen to do that on women before the age of menopause because the ovaries are very important producers of hormones, and even after menopause, they've shown that if you take the ovaries out even up to the age of 65, there's an increased risk of developing osteoporosis and cardiovascular disease, which can increase your mortality from these medical conditions. So you would only elect to remove the tubes and ovaries if there is a significantly increased risk that outweighs those potential problems. Obviously, if you do remove the tubes and ovaries, there is still the option of taking hormone therapy, but that presumes that there's no contraindications to taking hormones. So the overall message for ovarian cancer is that it's a relatively uncommon cancer. There's no good screening test, but if you have new symptoms, particularly related to the abdomen and pelvis, then it's worth seeing your GP to see whether an ultrasound to check the ovaries is an appropriate investigation. If they are concerned that there's a problem present, then they would then make an appropriate referral referral through for you to see a gynaecologist